We move on now to the escalating cost of healthcare in the country, which is proving to be a challenge for medical aid schemes, its members, as well as the public health system. This further creates a wider net in denying many the constitutional right to medical attention. General Practitioner Dr. Karlo Talbot speaks to us about this. Thank you so much for your time and welcome, Dr. Talbot. Let's first maybe define what is meant by the rising cost of healthcare in South Africa. Where are we rated and how?
Hi, Tumisang. Thanks so much for having me. I'm really excited to be joining you today. The one thing I can say definitely is that the cost of living has been increasing and everyone can feel it. Medical aid schemes are getting more and more expensive every year. There's an increase of about 9.2% annually, which is higher than inflation rates. So it is definitely a challenge for more and more people to keep up with their private medical insurance, and more people are having to look at using the public system, which caters for 80% of the country and is definitely overburdened and faces many challenges.
Having said that, Dr. Talbot, we are facing yet another bout of increases, the annual increases from medical aid schemes, and South Africans find themselves getting onto these medical aid schemes looking for alternatives at the same time. Is the space broad enough to cater for what is needed as a prototype, as a bespoke session for a South African that would be well suited for those who are not able to meet the high costs of living when it comes to servicing healthcare at this point in their lives?
Yes, so with the increasing costs and the challenges that everyone is facing, it's important to look at what's happening and what's available. I would also like to stress that people need to focus on their health and also focus on preventative care and keeping healthy. But there are some really great alternatives out there. There is, I work for a company called Ndlovu, and this provides online telemedicine. So this is an alternative that many more people are using, and it's a lot more affordable and accessible. Yes, so that is an alternative which people can look at.
With the dynamics at play in the South African healthcare system, does it then bode well for an argument of a universal healthcare, the likes of the NHI, that is yet to be implemented? And at this point, we still don't know when that will be implemented.
Yes, there has been talks of the NHI for a long time now, and the main idea is to pull together all the funds and to get help from the private sector to be able to provide healthcare, for more affordable healthcare for more people, and more affordable and quality healthcare. Although yes, you can't rely on the government completely for this. That's why it's great to use these private companies like Ndlovu that's providing affordable services. And they are there to help you with your basic health needs.
Thank you so much for your time and insights. Dr. Karlo Talbot is a general practitioner speaking to us on the business desk for this morning about the rising cost of healthcare in this country.